हेलो फ्रेंड्स। आज हम बात करेंगे एनाटॉमिकल स्नफ बॉक्स की। देखिए, आप अपनी अगर रिस्ट को देखिए तो रिस्ट को अगर आप ये डॉर्सम ऑफ द हैंड, दिस इज डॉर्सम ऑफ द हैंड एंड ये जो है ये पामर एस्पेक्ट ऑफ द हैंड है। अगर आप डॉर्सम ऑफ द हैंड को देखिए और अपनी थंब को जो है आप हाइपर एक्सटेंड करिए तो यहाँ पे एक ट्रायंगुलर डिप्रेशन बनता है। एक ट्रायंगुलर डिप्रेशन जो कुछ टेंडन्स के बीच में बनता है उसे हम कहते हैं एनाटॉमिकल स्नफ बॉक्स। तो आइए देखते हैं कि व्हाट आर द वेरियस मसल, द टेंडन ऑफ वेरियस मसल दैट फॉर्म्स द बाउंड्री ऑफ द एनाटॉमिकल स्नफ बॉक्स। So first of all, what is the location of the anatomical snuff box? As I have told you that if you abduct your thumb, then you will find at the dorsum of the hand you will find a triangular depression over here, and that triangular depression is known as anatomical snuff box. So it is a triangular depression on the lateral aspect of the wrist, and it is seen best when the thumb is abducted or the extended. When the thumb is extended or abducted, then only you can see the triangular area just dorsum of the hand around the wrist. You will find this depression, and this is known as anatomical snuff box. So let's see what are the various tendon that forms the boundary of the anatomical snuff box. So if you see, this is the anterior side and this is the posterior side. So anteriorly, the anterior, this is a triangular, the area is the anatomical snuff box area is triangular. So you can see here the two tendons, they form the anterior boundary of the anatomical snuff box. So one is the tendon of abductor pollicis longus. As the name indicate, abductor means the function of this muscle is to produce abduction, and pollicis is related to the pollex or the thumb, and longus means the length of this muscle is longer. So the tendon of the abductor pollicis longus, and the next tendon is extensor pollicis brevis tendon. So here you can see the and tendon that is known as extensor pollicis brevis tendon. So in name it comprises extensor, then pollicis, and the brevis. Extensor means that it is going to produce extension at the pollex or the thumb, and the size of this muscle is small. That is why the name includes brevis. So next is what is the which of the following muscle tendon form the posterior boundary of the anatomical snuff box. So you can see here this is the tendon of the extensor pollicis longus tendon. So this is the extensor pollicis longus tendon. Anteriorly you will find two tendon. One is the tendon of the extensor pollicis brevis, and the one is the tendon of the abductor pollicis longus. So this triangular area between these tendon is formed, it is known as anatomical snuff box. So it will have some structure into the roof. It is having a roof, then it is having a floor. So the roof comprised of if you see, this is the roof of the anatomical snuff box. So this roof comprised of skin, then underneath the skin you will find the superficial fascia, and once you dissect out the superficial fascia, you just separate the superficial fascia, you will find the deep fascia just beneath the superficial fascia of this region. And in this roof there runs the cephalic vein, and also the superficial branch of radial nerve also lies in the roof of the anatomical snuff box. So in the roof of the anatomical snuff box you will find there is two important content. One is cephalic vein and the one is the superficial branch of radial nerve. If you see the floor, how the floor is formed, in floor you will find two carpal bone. One is known as scaphoid and the one is trapezium. So in general, we have 8 carpal bone at the level of the wrist. 4 are situated in the proximal row and 4 are situated in the distal row. So scaphoid and trapezium, they are situated on the lateral side. Suppose this is the region of the carpal. So you will find two rows of the carpal. The four bones are attached in the distal row and four bones are attached into the proximal row. So just beneath the thumb you will find two bones, one in the proximal row that is known as scaphoid, and in the distal row you will find the first bone of the carpal on the lateral side just beneath the thumb is trapezium. So here you can see the two carpal bones are forming the floor of the anatomical snuff box, out of of which one is known as scaphoid and the one is trapezium. So let's see what are the content of the anatomical snuff box. So the main content of the anatomical snuff box is, you can see here, this is the radial artery. Radial artery, that is one of the important terminal branch of the brachial artery. When brachial artery reaches at the level of the neck of radius, then it divides into two branch. One is known as radial branch and the one is known as ulnar branch. So this radial artery, it runs into the forearm, anterior compartment of forearm, just beneath the brachioradialis muscle, and you can see here it traverses into the anatomical snuff box. So this area, you can see here, there are tendons, and this triangular area is known as anatomical snuff box. So you can see here there are two tendons on the anterior side. One is the tendon of extensor pollicis brevis, and that is the tendon of abductor pollicis longus, and posteriorly or laterally you will find this tendon, that is the tendon of the extensor pollicis longus. So you can see here this is the course of the radial artery, because you can see here radial artery at the lower end of the radius, that is just above the styloid process. It moves on the dorsal side of the hand and it travels through this anatomical snuff box, and then it goes on the dorsal side of the hand. So this is how the radial nerve is one of the important content of the anatomical snuff box. Beside this, in roof, we have already seen that in roof there is cephalic vein and the superficial branch of radial nerve, and that is also a content of the anatomical snuff box. Now, what are the various clinical implication of this anatomical snuff box? So you can see here this triangular depression is known as anatomical snuff box. So because you know that one of the important content of the anatomical snuff box is radial artery, so if you just place your thumb in the anatomical snuff box, you can feel the pulsation of the radial artery, and sometime you also give the intravenous fluid. Suppose you are not getting the vein, peripheral vein in a patient, then you can palpate for the, you can look for the cephalic vein, where you can give the intravenous fluid to the patient. Next, sometime there is tenderness. If you just press over this area, you will find the pain, and the pain is elicited. The pain is elicited because there is some scaphoid fracture. There is, in case of scaphoid fracture, you can just elicit the tenderness over this anatomical snuff box. Next is one disease that is known as decurve vein tenosynovitis. What happens in decurve vein tenosynovitis? Because of the overuse of these tendon of the anatomical snuff box, that is extensor pollicis brevis, abductor pollicis longus, and the extensor pollicis longus, all these tendons sometimes they get inflamed because their long term use, because of their regular use. So there the patient complains the pain in this area, that is in the region of the anatomical snuff box. So this is because there is some tendinitis, or you can say tenosynovitis, the synovial sheath that wraps these tendon, that get inflamed, that get swollen, there is redness, there is pain, there is temperature in this area. That is why this condition is known as decurve vein tenosynovitis. So this is all about the anatomical snuff box. We have seen like what are the boundary of this anatomical snuff box. Then we have seen what are the various content of the anatomical snuff box. Then there are some direct question asked in your various MCQ examination, like which of the following is not a content of radial fossa. So again, this anatomical snuff box is also known as radial fossa. So you know that cephalic vein lies over there, the radial artery lies in the cephalic vein, and the superficial branch of radial nerve, they lie in the roof of the anatomical snuff box, and the radial artery is the main content of the anatomical snuff box. So in this question, the correct option is D, branch of radial nerve is not a content of the anatomical snuff box or the radial fossa. So your answer will be the D, branch of the radial nerve is not a content of radial fossa or the anatomical snuff box. Next question is decurve vein disease affect. So they are asking which of the following tendon get affected in case of decurve vein synovitis. So we have seen that in decurve vein synovitis, the tendon of the muscle, the tendon of the muscle that are forming the boundary of the anatomical snuff box, they get inflamed. So the answer will be the tendon of abductor pollicis longus and extensor pollicis brevis. They get inflamed in case of decubital vein synovitis. So in decubital vein synovitis, your answer will be there is inflammation of the tendons of the abductor pollicis longus and the extensor pollicis brevis. So that's all about the anatomical snuff box. We have seen its boundary, the content, and the clinical implication of the anatomical snuff box, and what are the various MCQ asked in your exam. So thank you for watching and listening.